Hello, good morning, everyone. First of all, let me introduce myself. My name is Muhammad Akmal. Today, I would like to give a presentation about stroke symptom in older adult. In this presentation, I will explain the definition of stroke, tips of a stroke, seeing and symptoms, how to diagnose stroke using a fast, way to prevent stroke, and what we should do when stroke symptoms occur. Uh, First, stroke symptom in older adult. What is a stroke? Stroke is a medical emergency that occurs when blood flow to part of the brain is blocked or when a blood vessel in the brain ruptures. When a brain tissue does not receive enough oxygen and nutrition, brain scale can become damaged or die. Stroke can affect movement, speech, vision, balance, memory, and other body function. Older adults are at increased risk because stroke risk generally results with age and with cardiovascular risk factor. Stroke is neurological condition that occur when the blood supply to a part of the brain is into part of reduced, preventing brain tissue from receiving oxygen and nutrition. As a result, brain cell begin to die within a minute. Stroke is a medical emergency that requires immediate treatment to minimize brain damage and prevent long-term complication. Next, two tips of stroke. Ischemic stroke. Uh, Two tips of stroke. Ischemic stroke and hemorrhagic stroke caused by a blood clot for narrowing that's blood and blood. Hemorrhagic stroke caused by a blood vessel that's break and bleeds. Three, why is stroke an emergency? One, brain cell are highly dependent on continuous supply of oxygen and glucose. Two, without adequate blood flow, brain tissue and become injured very quickly. Three, early medication assessment help identify the type of stroke and determine appropriate treatment. Four, some treatment are time dependent, so delaying emergency care can increase the risk of permanent disability. Five, never wait for symptoms to disappear on their own. Next, four, mind sick and symptoms. Sudden weakness or numbness of the face, arm, or leg, especially on one side of the body. Sudden confusion or difficulty speaking or understanding speech. Sudden vision problem in one or both eyes. Sudden dizzying, loss of balance, or difficulty walking. Sudden severity of usually headache, especially when accompanied by other neurological symptoms. Next, fast recognize stroke quickly. Fast. One, face, two, arm, three, speech, four, time. Next, additional symptom in older adult. Some older adult may show sudden difficulty performing familiar activities. New confusion, reduced alertness, or unusual behavior can occur, especially when combined with other neurological symptoms. Sudden problem with coordination, swallowing, or walking might be warning signs. Symptoms can vary depending on which part of the brain affected. Even if symptom improve of disappear. Urgent medical evaluation is still important because tension, ischemic attack, TIA, TIA may have occurred. Next, how to prevent stroke, monitor and control blood pressure regularly, manage diabetes and cholesterol with appropriate treatment at follow-up. Do not smoke and avoid exposure to tobacco smoke. Next, what should do if stroke is suspected? Call the local emergency medical service immediately. Record the exact time the symptom were first noted or the last time the person was known to the bell. Keep the person safe, calm, and monitor it while waiting for help. Next, conclusion. Stroke is a serious medical emergency that can cause permanent disability or death. Common warning signs include sudden facial dropping, arm or leg weakness, speech difficulty, vision change, dizziness, and severe headaches. Remember fast, arm speed, and time. Stroke prevention includes controlling blood pressure and other risk factor, avoiding smoking, staying active, eating a balanced diet, and following medical active. Uh, yes, any question? Yes. Yes, you? Yes. Question number one, what are the common symptoms of a stroke? I answer, common symptoms of a stroke include sudden weakness or numbness on one set of body, difficult speaking, vision problem, dizziness, loss of balance, and severe headaches. Immediate medical attention in request if this symptom occurs. But question two, a stroke is a medical condition that occur when the blood supply to the part of the brain is interrupted or this is causing brain cell to the damage or they do to a lack of oxygen and nutrition. Thank you. Yes. Thank you for your attention and participation through this presentation. I hope you information I have shared has helped you better understand in this topic. Thank you once again for listening. Have a great day. Thank you.